Good afternoon. My name is Iman Kamal Abdullah, and today I will be presenting on gender-based violence in conflict-affected area of the Ethiopia, which is Tigray, Amhara, and Afar. This presentation highlights the scale of the crisis, who is the most affected, the cause, and policy solution that can support and recover and women empowerment. During the conflict in northern part of the Ethiopia, we saw a sharp increase in gender-based violence, especially targeting women and the girls. So, the GBV or gender-based violence included rape, gang rape, sexual assault, exploitation, physical violence, and psychological abuse. The conflict destroyed safety structure, police protection service, and the community support system, leaving women extremely vulnerable. So the issue is significant because GBV or gender-based violence leads to long-term trauma, affect women's physical and mental health, and expose weak governance and accountability. It also depends gender equality and the slowdown recovery efforts in conflict region. The most affected area were in Ethiopia, which is the northern part, as I told you, Tigray, Afar, and Amara, especially rural areas where access, no protection or support was almost absent. So those most impacted include women and the girls in conflicted controlled areas, internally displaced people, IDPs living in overcrowded camps, adolescent girls who faced even higher vulnerability, survivor with no access health care or legal services, displacement, insecurity, and the fear made reporting almost impossible, which means the real number are likely much higher. So let's look at into the deep. So the scale of the crisis is extremely alarming. Research showed that 9.7% of a women aged 15 to 49 in Tigray experienced some form of GBV during the conflict. For, 43.3% of the women reported sexual violence and including rape. More than 10,000 survivors sought medical care between 2020 up to 2023. So, in one step center, these numbers show not only the severity of the violence, but also the massive breakdown of protection system during the conflict. So, as you saw on the map, this is the highlighted part of the northern part of the Ethiopia. So this issue connected strongly with the three GCGOs, which is the first one, women empowerment, conflict reduce women safety agency, and the participation supporting empowerment is essentially for their recovery and the leadership. And the second one, governance. So weak institution, lack of rule of law, almost no accountability allowed this crime to continue without punishment. And also the last one with the health. Survivor faced serious physical injuries and a long-term mental problem overwhelming the already fragile health system. So, addressing GBV requires the improvement across all three GCGOs. So let's classify them. Sexual violence in these regions often included rape, gang rape, and forced pregnancy, sometimes used to intentionally as a weapon of war and terrorize the communities. So other forms included physical violence, reported by over 28% of the women, psychological violence affecting more than 40%. Many of these attacks happened in IDP, displaced people camps or area controlled by armed groups and where women had little or no protection. So these include different armed forces, military, security actors, showing how deeply governance and the law enforcement had collapsed. So let's see the problem analysis. The sixth factor during the GVV, the first one is conflict condition. So the conflict condition during active conflict, normal system of protection collapse. Armed groups move freely, communities flee, and there's no stable authority. In this environment, sexual violence became a tactic of a war used intentionally to terrorize, punish, and break down communities. So the chaos of fighting make it easy for perpetrators to act without fear and extremely difficult for survivor to seek help. So the second one, the economic help. The conflict destroyed farms, markets, and source of income. When families lose their livelihoods, women often become financially dependent or are forced into risky situations such as exploitation in exchange for food, shelter, and transport. Poverty increase and the vulnerability, and the women with no economic power have fewer options to protect themselves or leave abusive environment. The other one is also mass displacement. So millions of people were displaced, many living in overcrowded IDP camps, and these camps often lack lighting, security, privacy, and separate facilities for women. So living in tents, temporarily shelters without a door, make a woman and the girls exposed to attack both the day and the night. So displacement also means being away from supportive family network or families, so which increase their vulnerability. The other one is destroyed service. The conflict damaged hospitals, legal offices, shelters, hospitals, and also social services. When a health center closed, survivor cannot receive emergency medical treatment. PEEP kits, psychological support, documentation of injuries. When illegal institution collapses, women cannot report cases, and then it began the justice process to break down and leaves the survivors without any pathway to safety or healing. So the other one is weak law enforcement. Even before the conflict, reporting GBV was difficult. During the conflict, it became almost impossible because police were absent or overwhelmed, and also justice system were not functioning because of the war. And the perpetrators were often armed or powerful. So survivor feared retaliation, and when there is no investigation or punishment, so these perpetrators feel protected and the violence increases. The other one is patriarchal norms. So deep gender inequalities existed in some part of the Ethiopia, which make it the traditional beliefs often blame a woman for violence or pressure them to stay silent to protect the family honor. And the other one is why these factors matter? All six factors interact with each other. Conflict creates the opportunity for violence, poverty, displacement, and the destroyed service increase vulnerability. Weak justice system and the patriarchal culture allow violence to continue. So together, these forces make GBV in conflict affected Ethiopia, which is Amhara, Tigray, and Afar mainly, not just a security issue, but a deep humanitarian, social, and structural crisis that requires strong and long-term solution. So, what is the solution? Here it is: short-term plan, medium-term plan, and long-term plan. So, to solve this crisis, we need a short-term, medium-term, and long-term intervention. So, provide emergency medical care and the PAP kits, establish safe space and the mobile clinics, and also train nurses in the community more about GBV cases management. And the medium one is strengthen justice institution to ensure accountability and also support women empowerment through education and livelihood and the leadership training, and also integrate GBV prevention into peace building and the governance in governance program, because without peace that's not sustainable. So the longer term solution is rebuild the health and the support service and expand the legal aid and the documentation of cases. So to ensure justice system can prosecute the cases effectively. So these combined efforts create safer communities and support the longer term healing. So let's predict if no action taken in the northern part of the Ethiopia, which is my country, GPV case will continue to rise, and survivor will experience long-term trauma. Children exposed to violence may continue to the cycle, and the poverty and instability will worsen in affected region. However, if the right measures are implemented, GBV level can decrease significantly. Survivor will receive a proper health and psychological support. Women will become more empowered socially and economically, and the communities will be more stable and powerful. Meaningful action today directly shapes the future and affected women in the communities. Thank you for listening. This is the research based on data from BMG Global Health, the United Nations, WHO, and the other conflict-related GBV studies from the Ethiopia, northern part of the Ethiopia. I'm very happy to listen to me. Thank you.